Good afternoon, everybody. It's Dr. Rahul here from YourGPCircle. I hope you're all doing great. Today, I wanted to have a chat to you guys about heart attack and stroke. Some of you who follow our Facebook page, Instagram page, and so forth, or was on LinkedIn, a few days ago, you would have seen that I did a written post about heart attack and stroke and how it is actually the predominant, or one of the predominant causes of death in the UK, and actually the leading cause of death in the whole wide world, and why it is so important that people know their numbers such as their blood pressure, their cholesterol, their weight, because these are the risk factors for heart attack and stroke, and these things can be controlled. Okay, so the better you control those things, the less your risk of heart attack and stroke is. So today I just wanted to speak to you about something that we as doctors and GPs use called the Q-Risk-3. So Q-Risk-3, this is a risk calculator, a cardiovascular risk calculator that we use to come up with a percentage that for this particular patient, what is the risk of them having a heart attack or a stroke over the next 10 years. Okay, now into this risk calculator go a number of parameters, and it's individual for every single person. So that it depends on whether you're male or female, your age, your height, your weight, and hence your what we call the BMI, the body mass index, whether you have a family history, whether you smoke, whether you've got diabetes, and more recently they've been adding other medical conditions into the calculator as well, such as kidney disease, migraine, atrial fibrillation, which is irregular heartbeats, because we now recognize that all of these conditions and others they actually increase the risk of somebody developing heart attack and stroke. Okay, so this is a risk calculator that we use to try and predict what is the likelihood of this person, if they have these blood test results, or this blood pressure, if they carry on smoking and so forth, if they have these medical conditions, what is the risk of them having a heart attack or a stroke? Okay, so for example, the risk may be 15%. So that tells us or gives us an indication that if we just left things as they are, at this weight, this blood pressure, this smoking, that the risk of this person having a heart attack or stroke over the next 10 years is 15%. So just to give that a bit of context, so if we took the same person and stood 100 of them, identical 100 of them, 15 of them would have a heart attack or a stroke over the next 10 years. That's what we predict. Now, anything above 10%, we do classify as high risk. So therefore, that individual with a 15% risk, we'd be wanting to have a chat with them to try and address as many risk factors as we can to try and reduce that 15% down to less than 10%, or as down, further down as we can get it. And things like reducing weight, reducing the cholesterol, improving the blood pressure, stopping smoking, all of these things will significantly help that 15% come down. Okay, so that's a bit about risk calculators, cardiovascular disease, but I'm really a strong believer in all of us, especially those who are between 25 to 84 years of age, should have an annual health check, like an annual MOT, just like we do for our cars. We need to be more proactive about our health so we know what our current health status is. Okay, we do it for our cars, why not do it for our bodies? Every year, have a health check, have a health screen, get your Q-Risk-3 calculated so you know what is your risk. Because over the years, your risk can go up, but actually you can bring it down as well. Okay, and if you can control as many factors in your lifestyle as you can to give yourself the best chance of reducing the risk of you having a heart attack and stroke, then why not? These are things which are in our control, in your control, that we can do to try and help you stay healthier for longer. So once again, cardiovascular disease such as heart attack and stroke is the predominant cause of death in the UK and the predominant cause and leading cause of death in the world. There are things that can be done, we can all do as individuals, or by having blood tests and finding out what things need to be changed and improved, which can reduce your risk of having a heart attack and stroke. Think about that. Take care.